didn't sit down and seriously write, other than medical writing, obviously, for, I would say, until the last 4 or 5 years. This book really just sort of, it was one of those things that you've been thinking about for years, you end up sitting down, and it just sort of comes right out of you. But Dr. Francis Peabody said some years back that the art of care of the patient, that the most important thing in the care of the patient is caring for the patient. Patients come to us and they want something. They want to be healed. They want to feel better. They want to know what's going on with their body. They want to know what to expect. They want to know if it's dangerous. They want to know if they're going to die. They want to know if they're going to live and how to avoid death and how to avoid illness, how to get well. That's what they want to know, all of those things. We can translate that in millions of different ways. We can turn that into lots of different things. We can turn that into, if we choose, you want a CAT scan. We can turn that into, if we choose, you want a pill. We can choose to turn those desires of wanting to know what's wrong with you, wanting to get better, wanting to be well, wanting to avoid death. We can turn those desires into wanting an X-ray, wanting a pill, wanting a procedure. And yet, that's not what they wanted. We have turned it into that. And when I say we, I don't mean physicians necessarily. I mean the system, I mean our society, I mean patients, I mean physicians. I mean all of us. There is just an elaborate network of doers in this system who are all sort of contributing to this disastrous translation of I want to get well, I want to feel better, into I want an X-ray, I want a pill. If we stood up and said, it doesn't need to be X-rays and pills, it can be communication. I can tell you what's going on with your body right now. I can feel your body and give you a sense of how likely it is you're going to die, how ill you really are, how likely it is that you're going to get well in the next day versus the next 2 weeks. I can talk to you and I can communicate with you, and we can have a conversation and an interaction that is profoundly important and profoundly healing. It is wrong, just simply and flatly wrong, to believe that handing over the pill and the prescription, because it's a quick interaction, is going to save you time in the long run. It's not. It's not going to save you time. It's going to hurt you. And it's been hurting us for years, and here we are. We're looking at it. We're looking at the detritus of using pills as a proxy for human interaction, as using X-rays as a proxy for actually understanding a disease, or doing a physical examination, or touching a patient, or having a communication. We've been using proxies for years, and look where we are. And there's research to tell us that when a patient and a doctor walk into the room, before they ever walk into the exam room, the patient wants to be listened to. They want to know what's going on with their body, and they want to get better. The doctor thinks that the patient wants antibiotics. When they know the chief complaint is sore throat and they haven't walked into the room yet, the doctor's best guess as to what the patient wants is antibiotics. And the patient's actual desires are, I want to know what's wrong, I want to know if I'm going to get better and when, I want to know how. And when they walk out of the room, the thing that actually makes the patient most satisfied in their after-exam room survey is having been listened to, having been spoken to. And the thing that doesn't correlate with satisfaction is the piece of paper, the prescription. When you make a patient a genuine partner in the decision to move on to some higher technology, and as long as they understand the downsides of that technology too, and the uncertainty even of that technology, my experience is they're much happier to actually be part of the decision, part of the process. And you don't end up feeling like you're getting caught and called out for mistakes, because they're not your mistakes. The actual control lies where it should lie, with the patient. It's their body. They're the ones who should be choosing anyway. When I don't do a CAT scan of the head for somebody who's got a minor head injury, It is not because I say, bah, go home, this is bullshit. You're an idiot for even coming. What are you doing here? You idiot, you fool. You didn't need to come here. Go home. That's not the way it goes down. The way it goes down is, it turns out there's maybe 1% chance, maybe more like 0.5% chance, about 1 in 200, that you've got something important in your brain that we ought to find, that a CAT scan will find. We could do that. We could get the CAT scan. But it's about a 1 in 100 that we're going to find something important in there, in that neighborhood. Maybe 2 in 100 that will find something important, and maybe 1 in 1,000 that it's something somebody really genuinely needs to do something about. Imagine if we don't do the CAT scan, your other option is we don't do the CAT scan, and maybe you've got something in your brain that we need to find, in which case you're probably going to start to have problems over the next couple hours or days. You come back. That's no problem. It's very unlikely, about a 1 in 1,000 chance, that we're going to miss something that will kill you if we miss it. But it's possible. It's out there. Now, we can get the CAT scan instead. The problem with the CAT scan is it costs money. It's going to be a couple hours before it's done. And there's radiation that comes with it. So there's downsides to the CAT scan. If you would like to have the CAT scan, understanding those downsides, understanding it's going to be a wait, and understanding that there's probably a 99% chance or so that there's nothing on there that you need to worry about, and that if there is something on there that you need to worry about, it's going to start gradually popping up over the next couple hours or day or two, and you can come back. If you still want the CAT scan, that's fine. We'll do the CAT scan. I'm up for that. You know, this is a collaboration. It's your body. It's your risk. You take it. When it's the spectrum in which some doctors would do the CAT scan and some wouldn't, who cares? Let the patient decide. They get to choose. They just get to be informed. They're actually a partner in the care. You talk to them about whether or not they're going to get a CAT scan. You talk to them about whether or not they want it, and they choose. And my experience doing this tells me that I do very, very few CAT scans compared to my colleagues. And it's because most of my patients say, really? 99%? 99? I can't stay 3 hours for 99% chance that there's nothing in there. That's crazy. It's crazy talk. I'm going home. And I say, okay, so as long as you understand there's some chance there's a little blood in your brain. There's some chance that you're going to drop dead of this. Now, what are the chances? 1 in 1,000 or probably less, but it's real. It's out there. If you're okay with that chance, I'm fine with that. That's fine. It's totally up to you. It's your call, your body. And in the majority of cases I have found, they say, I'll come back if anything gets worse. And they go home. And they don't come back. And they're incredibly satisfied to have been part of that actual process of deciding whether they get the CAT scan or not. They're part of the process. And when they're part of the process, they feel like a partner, and they feel like they had control. They have a locus of control. It's what psychologists call it. They have a locus of control. And their locus of control allows them to believe that this was good for them because they chose it as much as anybody else chose it. And it wasn't a mystery. It was all transparent. And I document on the chart that they chose to not have the CAT scan understanding the risks. When you genuinely care about your patients and they feel it, when you got a smile on your face when you walk in the door, you say, hello, I'm Dr. Smith. It's great to see you. Oh, this is your wife. Hi, I'm Dr. Smith. I'm going to be your attending physician today, taking care of you. Tell me what you came in for, what's going on. And they get the sense that there's a genuine concern. It changes everything. And you don't get sued as much. People don't feel angry as much. People feel like they were listened to. They're more satisfied. And you use fewer resources that suck the life out of us. The x-rays that you know you didn't need, the admissions that you know you didn't need to do, the antibiotics that you know the patient won't benefit from, all of those things that suck the life out of us on a daily basis, they start to dissipate and go away because when there's genuine concern between you, you don't need those proxies. You don't need an x-ray to prove that you cared. You don't need a prescription to prove that you actually believe they're suffering. You don't need those things. They go away.